A patient asked a question, and they asked me what they can do to make sure that they're getting the most out of their plastic surgery procedure. And I want to spend some time answering that question. So the first thing is to make sure that you and your plastic surgeon have identified the problem that bothers you, have really drilled down on what it is you want fixed. And sometimes this is more than one problem or area. For example, a patient comes in and says that they want a tummy tuck. What I really need to drill down on is what all do they want changed? Do they need liposuction? Do they need fat injected into their butt? What else might they need to achieve the final result that they want? That's part one, is having that discussion with your plastic surgeon to figure out where you want to go. And then you and your plastic surgeon need to figure out how to get you there and if getting you there is possible. So once there's an understanding about where you want to go and you have a plan about how to get there, which may involve more than one procedure, then it's all about executing that plan and being compliant with the postoperative instructions. In my experience, what I have found that frustrates patients the most is a lack of efficacy of the procedure they had performed. So if you go on Real Self or talk to people, they often talk about how something didn't work. That's probably because it wasn't an aggressive enough treatment option, or it was the wrong treatment for a given problem. And so the best way to avoid that is to see a plastic surgeon who offers lots of different treatment options, so they are less likely to be biased by one thing. For example, I have lots of patients that come to me because cool sculpting didn't fix their abdominal fat. Now, they had cool sculpting performed by someone who isn't a plastic surgeon and can't do liposuction or perform a tummy tuck. So I felt bad because they were absolutely not a good candidate for cool sculpting. Not that cool sculpting doesn't necessarily work, but it was the wrong treatment option for this patient's problem. In other words, where she was and where she wanted to go, cool sculpting would not get her there. But because this provider can only perform cool sculpting, this provider sold the patient cool sculpting. And this patient spent thousands of dollars on an intervention that, even if it does work, isn't going to create the change that she wanted. So I cannot stress the importance of getting multiple opinions, or at least seeing a provider who offers multiple different treatment options to make sure that the treatment you are going to receive for a given problem is the best treatment for that problem. Having a plastic surgery procedure performed is a big investment. You're spending money, you're taking time off of work, and you're always taking a risk for complications. Now, we always do our best to make sure that your risk for complications is as low as possible and that your recovery is as easy as possible, but oftentimes those two things are competing with giving you the best possible result. What I mean by that is, let's take a tummy tuck, for example. The tighter and thinner that we make your abdominal skin, which is probably what you want, the higher the risk is for wound healing complications or problems healing that incision, because the blood flow to the skin that has to do all the healing is compromised the tighter and thinner that we make it. So it's our job to do our best to balance giving you the best possible result, along with balancing the risk for complications as well as your recovery, because we always want no complications and the easiest possible recovery, but oftentimes that would mean a lesser result. So it's about finding that balance. So the most important things that you need to worry about are making sure you make an informed decision, that you trust your plastic surgeon to help you get from A to B to where you want to be, and that you follow all of your postoperative and preoperative instructions to a T to minimize your chance of having any complications or problems. I find that the hardest part about being a plastic surgeon is managing expectations. And that happens at the end of the initial consult and at the time of the preoperative visit before surgery. Because what I'm trying to do is make sure that the patients understand what their likely result will be, and that it's not unrealistic or impossible. That's the hardest thing, because as plastic surgeons, we know and have an idea of what we can accomplish and how patients will look after we perform the procedures that they've chosen to have done. But there's no way that we can show patients what that would look like. I have 3D imaging applications and all the photography things you can imagine, and none of them really work all that great to show patients how they will probably look after they have a procedure. The only procedure that 3D imaging really works all that well for is primary breast augmentation in women with relatively small breasts and no ptosis. I also find it helpful in rhinoplasty and chin augmentation. So the hardest part is conveying and helping patients understand what their likely final result will be so they can decide if it's worth going through the surgery, spending the money, going through the recovery to get there. That is the hardest part. And that all comes down to managing expectations. And that's where you have to have an open line of communication with your plastic surgeon as well as your plastic surgeon's team. And you also need to trust us when we tell you something's not possible or unlikely. It is super important that you follow all of our postoperative instructions because it will help reduce your risk of any complications as well as speed up your recovery. There's really nothing we can do to make your body heal faster. There's lots of things you can do to make your body heal more slowly. So it's really important that you follow our postoperative instructions so we can get you through the healing process as quickly as possible and with the lowest risk of any complication. So in summary, first and foremost, make sure that you're having the correct procedure performed that will solve your problem. In other words, if you have bad jowls along your jawline, a neck lift will not fix that. You need a facelift. So having the correct procedure for the correct problem is step one. Step two is making sure that your likely outcome and result will be a positive enough change that it is worth going through the procedure and spending the money to have the procedure performed. The third step is following all the postoperative instructions and follow-up appointments and being compliant with the postoperative care so that you can heal with the lowest risk of complications. Check out our website at restoreplasticsurgery.com. There you can use our price estimator to generate estimates for any combination of procedures that you may be interested in. You can also find more information about all the procedures we offer. If you'd like to have your question answered or come on the show as a guest, use our SpeakPipe, which is essentially a voice recorder on our blog page. Finally, you can also submit a virtual consult where you send us photos as well as your concerns and we can reply with any recommendations. Follow us on Facebook and Instagram as well as Snapchat. Subscribe to my YouTube channel as well as my podcast wherever you get your podcasts.